Good afternoon. Hopefully everybody can hear us. We're going to try something a little different today, so give us a little bit of grace. Just to be completely honest, it feels a little awkward to be sitting here in the Dunklau boardroom speaking to all of you. A couple of quick housekeeping reminders. If you are participating virtually, please make sure your phone is on mute. It sounds like we have a couple of devices that are picking up some noise, so thank you. I have in the room with me Dr. Suchsdorf, who you know very well, and Paula Pittman, who is our Vice President of Human Resources. The three of us are going to speak a little bit today about COVID, our volumes, the vaccines, our policy. Sean Custard, VP of Professional Ancillary Services, is with us. I think Melinda Kentfield is going to join us here shortly as well, and we'll all kind of be available for questions at the end. So with that, we'll go ahead and get started. Maybe. Am I advancing the slides, Kathy? Didn't work.
Maybe it doesn't go that far.
Okay, so again, you see the agenda there today. I'll talk a little bit about our experience from a COVID perspective over the last months. Dr. Suchsdorf is going to talk about the vaccine, its safety and effectiveness. Paula Pittman is going to talk about our current vaccine policy. I'll briefly talk about kind of what's next, and then we'll leave some time for questions at the end. So I wanted to start with this slide. Many of you have probably seen this slide already, are really aware of the fact that we administered more than 13,000 doses to our community from late January through late May. Really proud of all that work. We also collected almost 10,000 samples for Test Nebraska from last June through this May. And again, really proud of the work that all of you have done, that we've done organizationally to care for our community in the last year. So just wanted to highlight that kind of one more time, and again, say thank you. I know a lot of you volunteered and participated in those events in some way, shape, or form. So again, thank you. Again, just a little bit about our experience. You've seen many of these slides as well. Our peak from an inpatient perspective was last November at 60 admissions, COVID-19 admissions in November. That trended down earlier this year. We are starting to see those numbers trend back up. We had 7 in August. Here we are on the 10th of September, only a third of the way through the month, and we already have had 5 admissions. So we'll kind of see what the coming weeks bring. From an emergency department perspective, very similar trend. I would clarify that these are patients who come through the emergency department and are tested and ultimately test positive. We've had hundreds and hundreds more who have come to the ED to be tested who have not tested positive. So these are just positive results. But again, we see that trending back up in August, and that's been our experience so far in September as well. A little more data. We've done a lot of work around monoclonal antibody treatments, done more than 300 of those since last November. Again, really proud of this work. I think we, proportionally to our size, have probably given as many or more treatments than maybe anybody in the state of Nebraska. So really proud of that work. Again, you can see that really ramped back up here in August. I think most of this week, we've been doing 3 or 4 a day, so that continues to be a lot of what we're doing. And I think those numbers certainly have helped us to keep people out of the hospital and even probably save lives. So again, really appreciative of all that work. And then at the bottom is just our Dunklau Gardens numbers. We've had very good experience. We've been really transparent that we've had 12 residents over the last 18 months or so who have contracted COVID. We've had 2 that have been considered COVID-related deaths. Both of those very tragic. At the same time, when you compare our results to others in the state, certainly based upon our size, I would put our experience up against anybody. So again, thank you for the great work by the Duncloud Gardens team. So I think Dr. Sugsdorf now is just going to talk a little bit about vaccine safety and effectiveness.
Yeah, thank you, everybody. Well, and first of all, I wanted to thank everybody for everything they do here. We couldn't have treated all these patients and taken care of everyone without you. So you're all very important, and we all care about you, which is why we're here to hopefully answer your questions and encourage you to get the vaccine. The vaccine is so important. We've seen that only 5% of the patients in the hospital or have positive cases or that die of COVID anymore are those that are vaccinated. So everyone that is having trouble with COVID right now are unvaccinated, and we don't want that to happen to you. And so that's why we're here. All of the data about the vaccine is good. It's showing that the vaccine is safe. It's showing that the vaccine is effective. It's the best vaccine I've ever seen. I have expertise in vaccines. I'm certified in giving vaccines for travel and everything else. So I'm telling you, this vaccine is the safest thing we've ever worked with. All the things you may have heard about the vaccine that are turning out to be false information, misinformation, and constantly being debunked on a daily basis, the things that are out there in the world. And I understand that you've heard things from people that you trust, whether it's a politician or it's a news station or it's a friend or relative that you trust have told you misinformation, but what we're trying to tell you now is that's false information, and people here in the hospital want to try to help you understand that information is not good, and answer your questions about that. What's on the next slide? Anything else I can?
It's just the vaccination rate.
Yeah, so our vaccination rate in our county is it's approaching 60% in the people that are eligible for the vaccine, but overall, when you add in children, it's about 50% fully vaccinated. And so that leaves 50% of our population vulnerable to COVID. And then we had our data about our employees here. About 79% are fully vaccinated, with 21% yet to get vaccinated if possible. And our admissions, I think we went through this already, but our vaccinated number of patients have been very low, at only 4, and the rest of them are all not vaccinated. And so you can see the risk of the patients not being vaccinated are the ones that we're now taking care of and have for several months now. The Delta variant is even more contagious. It is covered by the vaccine, but it's more contagious and causing morbidity and mortality with our patients. 4 were not vaccinated, or sorry, 8 were not fully vaccinated and 4 were. But those 4 that were vaccinated or in the hospital were not as sick. They were not in the ICU. They were able to go home or will be going home soon. Whereas we've had those folks that are not fully vaccinated are much sicker. And so,
And Angela, I might add that of the 4 that were fully vaccinated, I think most or all of those individuals were elderly in their
Correct.
70s and 80s.
that's right. That's absolutely right.
Our experience with those who are not fully vaccinated, we've had individuals, I think, basically from their mid-30s to late 50s. That strikes pretty close home to some of us, many of us who kind of
Yes.
fit those those categories.
Yeah, with as young as 24. But yeah, that group is much younger and very sick.
Okay, Kathy. So I'm going to introduce Paula Pittman. Many of you probably know Paula. Paula is our corporate VP of HR. And so she's going to talk a little bit about the vaccine policy.
Thank you. Kathy, you can go ahead and advance to all the points on the slide. So to help ensure the safety of our employees and our patients in the community, as you're undoubtedly aware, on August 12th, we joined with 7 other leading healthcare organizations in the metro area to institute a mandatory vaccination requirement for our employees. This mandatory vaccination requirement applies to all employees, applies to physicians who are employed and contracted, and also to volunteers. We do have a exemption process for medical and religious and philosophical exemptions. If you would care to look at the policy, it is posted on the intranet as in addition to the actual exemption form itself. Once the exemption form is filled out, there are instructions on the form. It should be submitted to employee health and employee relations for the religious and philosophical exemptions. They are viewed on a daily basis, and if your exemption is approved, you should receive confirmation back within a couple days unless we require additional information to process your exemption. The dates for compliance for leaders, which is defined as supervisors and up, is October 15th. And for all other team members, it's November 1st. So what this means is that you either have to have both vaccinations and be fully vaccinated by those dates, or have an approved exemption on file with employee health. We do have questions and answers we posted on the internet. As we have received those over the past month or so, we've made sure to post those. So again, if there are any questions, I would encourage you to go to the internet page to take a look at that. Again, we would ask everyone to make sure to have your full vaccination by these dates for compliance or have an approved exemption in place. Otherwise, employees who are not vaccinated and have an exemption will be required to mask in all areas.
And then we'll leave some time at the end for questions as well. So just a couple more things. This slide is simply illustrates the statewide COVID-related hospitalizations. We get this data on a weekly basis. So you can see as of September 5th, there were 361 patients hospitalized throughout the state. For reference, last November, when we had our peak here locally with 60 patients, that number fell just short of 1,000 patients statewide. What you see with those dark lines, those dark horizontal lines, is basically a doubling of those numbers. So myself, Dr. Supsdorf, others are on a weekly call with people throughout the state, including people from the Med Center, a lot of public health people. They've been predicting now for a couple months that these numbers would double every 3 to 4 weeks. And that's essentially what we've seen play out. So if you look at 74 cases on the 11th of July, a month later, that had more than doubled to 185 cases. Again, we see from August to the beginning of August till the end of August, a doubling of 150 to more than 300. And so, if you play that out, we would anticipate that we would have, in the ballpark of 750 cases statewide by the end of September. So a very similar surge to what we saw statewide last November. Now, these are estimates. They may not play out and be accurate. They may end up being high. They may end up being low. There's several things that play into that. One, obviously, Dr. Supsdorf talked about the Delta variant and how much more contagious it is. We're all acutely aware that schools have recently opened. I just heard today on a call that of schools throughout the state that have already had, within less than a month of school, have already had half or more as many cases this year in their schools they had all of last year. So I think certainly that has an opportunity to impact our numbers. So again, just wanted to kind of be really transparent about kind of what we are anticipating those numbers to do. So again, I think it's pretty realistic to think that our numbers could, we're at 5 today. We've been at 5 or 6 most of this week. I think it's realistic that those numbers could double or even go higher in the coming weeks. But again, that's just an estimate, and we'll have to kind of see how things play out. So I just kind of have one more slide in terms of what's next. So here's what I would ask. Dr. Suchsdorf talked about, all the information out there in the public, friends, family, social media, we all see it. I would simply ask this: if you're not already vaccinated, please visit with your primary care physician about your specific risk and benefits. I think there's all kinds of studies out there about respected professions. Physicians and nurses almost always rank at the very top of that list. I think we, as people in healthcare, have trusted physicians, have trusted our own physicians exclusively in the past, and there's no reason not to continue to do that. So everybody's situation is different, and I would just simply ask you to visit with your primary care physician about your specific risk and benefits, and have that conversation about what's best for you. I'd also just say, if you're not able to get vaccinated, to please work through the exemption process. I get lots of questions about what that means. I think it's pretty well laid out in the policy. And if you aren't able to get vaccinated and you haven't yet started that process, please start that process here quickly and just work through that process. The other thing I would say is just, we all need to continue to live our values. If you go to the next one, Kathy. So, providing patient-centered care that protects our patients and residents. I think, more than ever, we need to be careful regardless of our vaccination status, make sure we're masking and hand washing and doing all of those things that we've done the last 18 months or so to protect our patients and residents. And respect every individual regardless of vaccination status. It's become a very sensitive, emotional issue. I get it. Most of us, but not all of us, are vaccinated. And just ask everybody to continue to demonstrate respect to everybody, patients and team members, regardless of their vaccination status. Again, we don't know what the weeks ahead will bring, but just like the last 18 months, the only way we get through that is to work together as one team within your department and across the organization, and obviously, continue to pursue excellence and serve our community. And then finally, just continue doing what we've done the last year. As Dr. Suchsdorf said, all of you guys have done a fantastic job of taking care of patients and/or taking care of the people that take care of patients, and just continue to do that and be the meaning of care to everybody you come into contact with. So again, a big thank you. I've said this many times. I'm super proud of the organization and all that you have done. It's been a really hard year. I can say I'm more proud to work with all of you and be a part of this organization today than I've ever been. Doesn't mean we're perfect. It doesn't mean we agree on everything, but again, really proud of what we've done in the last year. So I want to make sure everybody hears that message of thank you. And then I think we can open it up to questions. Part of what we'll do again is, if we've got questions we can answer here today, we'll do that. If there's other questions, it's possible that we may have to kind of get back to people and share that information later. So can they do that via the chat?
Or they can unmute themselves.
So you can either use the chat function or unmute yourself. I'm hoping that somebody's brave enough to to ask the first question.
So this is Sean. I'll ask the first question. As I've interviewed, or not interviewed, if I've still on the staff and rounding, one of the more common reasons I get for not getting the vaccination is, I'm kind of directing this to you, Dr. Schugstorff.
Sure.
The vaccine was rushed. I don't trust the technology behind it. I trust my own immune system more than the rushed vaccine. Can you comment on that a little bit?
Sure. So let me start off with saying that I understand that this data is difficult to interpret. It took the doctors years of training to understand these studies that are being pushed out and being worked on meticulously by lots of different places, lots of different countries. And so it's all being compiled to come up with the same answer, is that the vaccines are safe. This technology is hard to explain, but it is very safe. It's been being studied for many years. And the reason we were able to get the vaccine out quicker than the average vaccine is because this technology had been worked on for many years. We were able to take the genetic material of this virus, plug it into this vaccine, and then produce the vaccine quickly. It's been tested. Initially, it was tested on close to 50,000 people in the first studies. And then, now millions of people have had this vaccine and they're doing great. There's a very low side effect profile. And it is producing a better response in your immune system than the actual virus. It's protecting you better than your own immune system would be able to protect by just contracting the virus. So it's basically supercharging your immune system to fight against the virus if you come in contact with it. So it works better than your immune system. And there's lots of studies out there that are difficult to understand because the immune system is difficult to understand. So, to summarize that into something that everybody in the whole public arena can understand is difficult. But you have to trust us doctors that are able to understand that data and then try to explain it to you all. So doctors are amongst the most vaccinated population because we understand the data and we understand the technology and the science behind it. So we also are the most likely to get our children vaccinated. And so we believe so much in this vaccine that all of us around here for sure have vaccinated our children if they're eligible. And then the people who have children that are younger than 12 years old have them in clinical trials. So you can talk to any of us. We know somebody who has a child in a clinical trial. We know somebody that's, my daughter's been vaccinated. She turned 12 in June. And the same week she turned 12, I had her vaccinated, her first dose of Pfizer, and she did great. So yes, please ask us about clinical trials and about how we got our children vaccinated, how we got vaccinated. We'd be happy to talk to anybody about that.
Thank you.
While we're waiting for questions, just a quick comment on that. One thing I've heard from folks too is, what we don't know what the long-term effects of the vaccine are. And, my simple layman response has been a couple things, and comment on this. One is, when we created a polio vaccine decades ago, nobody knew what the long-term effect to the polio vaccine was either. But what we do know today, we're starting to learn, we learn more and more every day, is what the long-term effect is of having COVID. And hospitals throughout the state, hospitals throughout the country have started and are full of patients in these long hauler programs. So people who have had COVID who are having long-term effects, and there's this huge demand for it. And so part of my response anyway as a layperson has been, one, we do believe it's safe, as you said. Two, if you want to argue we don't know the long-term effects, I would probably argue, even if that is true, we do know a lot about and are learning a lot about the long-term effects of COVID, most of which is not positive. I even heard something the other day that struck me. all these college teams and pro teams have been tracking all this data. And they said that for their data shows that an athlete, a professional athlete who gets COVID, it's at least on the average, at least 90 days before they get back to any type of baseline. So I'm thinking, gosh, these are the fittest people, they're younger. That's what they do all day long. They're fit, they're healthy, and they're taking 90 days to get back to a baseline. I'm not that person from an age perspective or a fitness perspective. Most of us aren't. And so I just think there's going to be lots of long-term effects that we learn of having COVID. I worry more about that than I do any long-term effect of having a shot.
I do too. So even if you talk about the short-term effects of a vaccine, almost everybody has some symptoms after they get the vaccine. They have some achiness, or they have a little bit of fever, or they really don't feel good for the next 12 hours. But it's 12 hours, it's just 12 hours. So, get your vaccine and then plan to take that next day off. I got mine on a Friday afternoon, so that Saturday I just watched movies on the couch. And so I think that would work for just about anybody. But long-term effects of the vaccine, we aren't seeing too much going on with that so far. But yes, the long-term effects of COVID itself, I don't know anybody who doesn't have some sort of long-term effect from having COVID infection. And some are as mild as they still don't smell quite right. They still don't taste food quite the way they used to. They're still tired 6 months later. But all the way to they still can't breathe right. They're still on oxygen. They're still, they can't think straight. They're chronically fatigued to the point where they can't work. So these are all really serious side effects from having COVID infection. Whereas we're not seeing much of anything from the vaccine. You might have a case report here or there, but everybody I know who's had COVID has a long-term side effect of some sort. So.
Do you have any questions?
Nobody's got a question?
Can you speak to why some people are getting COVID? And they are fully vaccinated. Is or can there be a list of articles that you trust that we can read to better understand the vaccine?
Okay. So why are some people still getting the infection? So the vaccine, it works and it produces a response, but you can still have, you can still be exposed to the virus and then mount an infection, but it's so less severe. It's very mild. And even if you get sick enough to end up in the hospital, you don't end up in the ICU and you don't die. You might have a few cases like we have upstairs where they're sick and they require a short hospitalization, but not a long hospitalization. So the vaccine's working, and it's just like any other vaccine that we've seen in the past. I know many of you have listened to me talk about getting your influenza vaccine over the last 15 years. And I've always said, you may not be completely protected where you won't get sick, but you certainly won't be in the hospital, and you won't be able to shed as much virus and spread it to your family as easily as if you had been vaccinated. So the vaccine is working. It's decreasing the mortality, so decreasing the risk of death. It's decreasing the risk of going to the ICU. But 95% effective. So those 5% are just getting mild illness. So that's actually a good vaccine. That's an excellent vaccine. We haven't had a vaccine that's ever been that good. So
yeah, can I just comment and maybe follow up? So I remember early on, a year ago when we were just starting to study the vaccines, and as I remember it very distinctly on TV one night, they were talking about this goal of having a vaccine that was somewhere between 50 and 65% effective. And I think the initial data for Pfizer and Moderna was more like 90 to 95%. And so just maybe comment to that. And then also, I know the flu vaccine, I believe the flu vaccine its effectiveness varies from year to year based upon the strain, which to me is similar to the variants. It's going to be more or less effective against variants, but yet still effective. And I think I had always heard that flu vaccines were somewhere between 40 and 60% effective every year. Is that kind of ballpark? Thoughts on that?
Yeah, the influenza vaccine, the reason that we see such a variation from year to year is that, okay, the reason we see variation from year to year on the influenza vaccine is more because of the strains in the vaccine are not what's circulating. And so right now we have variants that are protected in the COVID vaccines, whereas you can have years where you're completely not protected from influenza vaccines, if that's what you're getting at with the effectiveness. Yeah, we were surprised to see data, or we're always shooting for a vaccine to be about 60% effective, but to have it come out and be 95% effective initially, and maybe a little less with the variant having, more symptoms with more virus that's more contagious, you're going to have a few more infections sneak by. But to have a vaccine that's overall 85 to 95% effective is phenomenal. So
I guess my larger point too is, originally to your point,
Any idea?
Dr. Suchdorf, the vaccine was really was not to keep everybody from getting COVID. It was to keep people from being severely sick, from being hospitalized, and from ultimately,
Right.
from potentially dying from it. And somewhere along the line, that expectation got changed from that, its original intent, which I think it's far exceeded what it was originally intended to do, to now, when somebody has a vaccine breakthrough, we see that as a sign that the vaccine's not working. And I just think that's something that's happened. I don't know exactly how, but that's been kind of a transition.
And the second part of the other question was whether or not I had any papers for people to read. So the CDC website is probably the best accumulation of all the data that everyone has reviewed and has found to be most useful. So I would go to the CDC website, cdc.gov, and look up anything there. I would trust anything the CDC says, and all of the data is right there. What did you say about children?
Any idea on when the vaccine will be approved for kids younger than 12?
Yeah, great question. They're currently in clinical trials, and they're working as hard as they can to get that group finalized. I think that'll probably be with, they've said end of August, they've said the end of September. I bet it'll be closer to November. But we'll see.
What is your opinion on
Again,
COVID?
just real quick, please, if you're online, please mute your phone. We're
Hearing someone. Okay.
What is your opinion on the COVID booster shot?
Yeah, that's another good question. We don't have any approval from the FDA on that yet. So there's still people looking at that. That is probably going to show that we may have some benefit from a booster eventually. I think it's most important to concentrate on first doses right now. I think we're going to be well protected with those first two shots, those of us that have been vaccinated. So I would not worry about that right now. I think eventually we may need a booster, but I think we better wait for a little more data on that if that's absolutely necessary, and also so that we can share vaccine with everyone who's not vaccinated yet, as well as countries outside of the United States who still haven't gotten any vaccine. We need to push it in that direction, I believe. And that would protect all of us, because we're such a international society where we have people coming into our country from all different directions, and us going to visit other countries. That to have a global protection would be most important first. And I think that, the World Health Organization is working on that too. But I think we'll be concentrating on getting first doses out. And I know, what the president put out yesterday mentions stuff about boosters, but that's not yet been approved by the FDA. So we have to wait a little bit longer for that.
You mentioned the president's,
That's one of the questions.
okay.
Okay,
So just real quick, and if this doesn't answer the question, let me know, but yes, we're acutely aware President Biden announced a plan yesterday. I think it was entitled something like The Path Out of the Pandemic. I think there's either 6 or 8 kind of primary focuses about how we would go about that as a country. So we are aware of that. I do think that has the potential, well, I think that probably will impact our organization in some way, shape, or form. It may ultimately impact our vaccine policy, but we don't yet know the details of that, the details of how that will work from an OSHA perspective. All those rules and regulations have not yet been finalized or made available to us, and so we will, over the coming days and weeks, be looking at that information, and we'll reach back out to people in terms of if that impacts kind of where we go and what we do organizationally.
The last part was, will we have more testing for non-vaccinated employees?
So the question was, will we have more testing for non-vaccinated employees? I would say probably. That is one of the things that's in the proposal. It says something, I think it's all employers of 100 or more people, either people have to be vaccinated or you have to produce a negative test result on a weekly basis for anybody who's unvaccinated. So that is something that's in that proposal. And again, as that kind of gets flushed out into actual rules and regulations, executive orders, we'll be reviewing that. And that very well may change kind of our own internal policy and how we have to do that.
Yeah, to echo what Brett is saying, I mean, this is a rapidly evolving area. So we're in the process of looking at the operational and legal aspects of that. But as the COVID-19 action plan is currently written, it does appear highly likely that under 2 prongs, the OSHA emergency temporary standard and the CMS standard, that we will likely require testing of non-vaccinated employees. And they must present a negative test every week in order to be able to work at this point. But again, it's still in the process of being fleshed out, and there should be some additional information coming out soon and perhaps finalized in October.
What is your opinion on the vaccine and pregnant women?
and pregnant women. So lots of pregnant women have been studied after they've been vaccinated. They've seen absolutely no increase in abnormal births or abnormal babies from the vaccine or from or babies from women who've been vaccinated. So it's showing that it's very effective and it's very safe. What's not been good for pregnant women has been infections. So the unvaccinated pregnant woman who gets COVID is at very high risk of ending up on a ventilator, is very high risk of mortality or dying of COVID disease and having side effects of the disease. So what's not good for pregnant women is getting infected. And the vaccine has been very effective for the pregnant women and protecting their babies. And without any ill effects to babies that they've found in studies so far. So very good news for pregnancy.
And I think the National OB Society recently came up with a statement fully supporting that pregnant women or people wanting to get pregnant vaccinated.
Yeah, with no changes to fertility, no changes to getting pregnant or staying pregnant, no changes at all in the vaccinated women arm of the studies. And so the American College of Obstetrics and Gynecology, or ACOG, strongly recommends vaccination for all women of childbearing age and pregnant women. So, good question.
I didn't put BMP and an A1C. I thought I put that in there.
Oh,
Okay.
Okay, so it doesn't look like we have any more questions. Somebody said thank you. You're welcome.
Oh, here's one. In your opinion, is the vaccination going to be a yearly vaccine along with the flu shot?
Well, I do know that they're combining the two in one of the products, that they're going to have a product that's both influenza and COVID vaccination at the same time. And I'm sorry, I don't remember which company it is to give them credit for that, but I know that's coming and going to be available this winter. But I don't know the answer to that, because everyone who's gotten the vaccine, it's been, just over a year for those people that were in the study, the initial phase 3 studies. And so that data is still coming out. So they're still testing those people and seeing if they still have a reaction to the vaccine, they still have antibodies to the vaccine. And so we won't know that for a while yet, whether or not we need a booster every year. Possible, but maybe not. I mean, it's a really good vaccine producing big responses in our immune system, so we may not. We'll see.
I would assume some of that too may also depend upon what we see from variants, you know, as variants change.
Cover those variants.
Whatever the most
That's
recent
true.
variants are.
Yeah, and so far we haven't had a variant that's not covered by the vaccine, but that's as this virus circulates more and more, it's going to mutate more and more. And so that's what produces these variants. And so we probably will have a variant that eventually is not covered by this vaccine, but will be covered by the next booster.
MFH OB providers have just completed further literature review and education on COVID vaccinations for prenatal OB providers and breastfeeding women. Please contact these providers as well. They are available to learn more about the evidence-based research on this population.
So they're just
Great, yeah. Yep, so if you have questions, ask your OB physicians. They'll be happy to share everything they know about the vaccine, and what their society is recommending and what they recommend, so.
So if there aren't any more questions, I'd kind of make one kind of closing comment, which is simply this. You know, I've been asked some variation of this question, which is, you know, will our policy relative to vaccines change in terms of whether or not we allow exemptions, et cetera. And, you know, I think it will. But I don't know. I mean, these things are evolving. I've said before, I never would have thought a year ago that we'd be here having this conversation today. And so things will evolve either through, you know, President Biden's plan, new research about vaccines and booster shots, all of that's changing, you know, if not weekly, certainly monthly. The other thing I would add is, you know, we have had a number of cases here recently where our patients, our residents are more and more frequently asking us if our team members are vaccinated. And throughout the system, we've had a number of requests where people have basically requested that only vaccinated staff care for them. And so my point in sharing that is, you know, we're a business just like any other business. And as a business, we have customers, patients, residents, and others. And as their needs, as their wants, as their demands change, we're going to have to react to that over time as well. So I don't know what our policy will be in the future. I just think it's pretty likely that it'll look at least somewhat different than it does today. And we'll just have to see kind of where things evolve. But again, I think we've been really transparent about kind of as these things come up, sharing information with you. We commit to you to continue to do that. I hope you feel really comfortable reaching out to myself, Melinda, Sean, Dr. Suchsdorf. We're happy to get any of your questions, you know, call, stop by, email. There's no dumb question. We're not going to hold it against anybody, but just ask us. We'd love to have those conversations with people. Okay, I think we're done. Again, thank you both for your time today and most certainly for your service to the organization over the last 18 months or so. And I tell you, I'm pretty optimistic about the future. I think we may be in for some tough days and weeks ahead, but I'm really optimistic that all of us together will rise up and meet that challenge, and that better days are ahead. And ultimately, we're going to be a better organization for having gone through what we've gone through the last couple of years. Thank you.